So, good morning everyone and welcome to Health and Environment Dynamics, translating exposome research to support integrated policy making. I'm Jane Evans from Beta Technology and a partner in the LongITools project, and I'm going to be your host for the first part of this webinar. This event is a really important milestone for our project LongITools. Well, that's one of 9 projects funded by the European Commission's Horizon 2020 research programme that's been set up specifically to study the human exposome, and we're just starting our journey to connect science and policy making, and this event is a key part of that journey. So you're going to hear all about the exposome, about LongITools and about the European Human Exposome Network later from the project's coordinator, Professor Savannah Siebert from the University of Lobo. We've also brought together a group of leading experts to debate the issue of connecting science and policy in the context of the exposome, and I'm really looking forward to the outcome of that discussion, and this is your opportunity as the audience to ask us questions. We have a really diverse audience today, made up of policymakers, academics and representatives from NGOs, public bodies and other exposome projects, all adding to this really interesting debate. But before we get started, I'd just like to run through some housekeeping with you. So, all questions from the audience will be answered during the panel discussion, not after the individual speakers. You can ask your question at any time via the Q&A function in the Teams Live platform, and it really helps us if you could indicate if your question is aimed at a specific person. We really do encourage you to ask us questions, as we really see this event as being a forum for a two-way dialogue. We also have the opportunity to like questions. So if someone has already asked a question that you were going to ask, or you think a question is of particular importance, then please like the question, and we will then prioritise those if we start running out of time in the Q&A session. So this webinar is being recorded, and you will have access to the recording after the event. So welcome everyone, and we will kick off with the presentations. We're just having to make a few minor adjustments to the running order. So we're actually going to start the speaker programme with Savannah Siebert, the LongITools project coordinator. He's also Professor of Life Course Epidemiology at the University of Oulu in Finland. His main research interest is in the characterisation of biological, social and environmental interactions that are influencing the risk of obesity, type 2 diabetes and cardiovascular disease. He's got a huge amount of experience in EU projects, and is a good advocate, strong advocate of collaborative EU research. So it's with great pleasure that I hand you over to Savannah.
Thank you, Jane. Thanks a lot for this introduction. Let me start by sharing my screen. Sorry about that. All right, so good day everyone. It's a really great pleasure to be here today, and thanks again Jane and teams from Beta Technology for also organizing this science connecting policy event for the LongITools project and for the European Exposome Network. Yes?
Sorry, we can't see your slides.
You can see my slide.
No.
I'll do that again. Oh, is it now?
Yeah.
Yeah. So this is today. So I'm going to give you a short presentation on the exposome and why this is important for us as scientists and innovation project, but also why is it, we believe, important to understand these concepts for citizens and policymakers. So let's start and sit back and watching these videos
Living environments and lifestyles have changed rapidly as a result of urbanisation, climate change, the digital revolution and population growth. There has also been an increase in the prevalence of cardiometabolic and cardiovascular diseases, including obesity and type 2 diabetes. In many cases, the risk factors for these diseases are man-made and could be avoided. They often relate to the air we breathe in, the food we consume, and the quality of our living environment. A long, healthy life is the goal for many people. However, from conception onwards, we're exposed to risks and opportunities to grow, live, and age healthily. This includes exposure to multiple environmental conditions, including air pollution, noise pollution, and adverse living environments. Exposures vary for each person, depending on lifestyle and societal factors such as work, family, education, healthcare, and diet. And these factors ultimately influence our capacity to make healthy choices for ourselves. These exposures often act on health by a synergistic or cumulative effect and are collectively defined as the external exposome. Previous research has shown that these environmental, social, and societal exposures are related to the epidemics of obesity, type 2 diabetes, atherosclerosis, heart disease, and other cardiovascular diseases. The key is to understand how these exposures work together to produce biological effects within our bodies. For example, how they interact with our genetic predispositions and the expressions of these via epigenetics, metabolic, and aging pathways. Our internal exposome. The LongITools researchers will analyse and compare huge sets of human data from European cohorts and clinical trials to define how the external exposome and the associated internal response relate to our health. It is hoped that the findings will enable us to further understand the risk of developing cardiometabolic and cardiovascular disease, ultimately leading to interventions or further research that enable us all to live healthy lives in a sustainable environment.
Okay, so sorry, I was just disturbed by something. So after this video, so let me explain a little bit more in details and in terms of layman terms what we understand in the concept of the exposome and why this is important for us. So first of all, LongITools. Who are we? So LongITools is a European project funded under the Horizon 2020 exposome toolbox cluster. This is a 5-year project where we received together 12 million euro fundings to work on the exposome and how it is relevant to the study of chronic cardiovascular and metabolic diseases. So this just brief introduction about who we are as a LongITools consortium. So this is a consortium of 18 partners. You can see the universities and academic partners in green, and also 3 SMEs that are working with us together to work on this project and deliver its key exploitable results. One particular important aspect of the project is to work with already available data and to use data from European cohorts, clinical trials, and also biobanks to understand the exposome and also to understand its related effect and how these develop in relation to the risk of cardiovascular and cardiometabolic diseases. So what is the exposome? So the exposome is a relatively new concept in epidemiological sciences, and it has first appeared in the scientific literature from the seminal paper from Chris Wild on working on cancer epidemiology, where he bring the term in terms of comparing it to the precision we are gaining with a study of the genome, saying that we should have the same sort of, or should strive towards the same precision in the description of the exposures. So in short, these sentences are sort of summarizing quite well what is the concept of the exposome and how we are trying to operationalize it in research. Is that we realize that pollution harms our health and knows no border. It affects everybody through the air we breathe, the water we drink, the products we are consuming, and the environment we work, live, and age in. And the sum of all those environmental exposures, including the biological responses to it, what we refer to it in the video to the internal exposome over a lifetime, is called the human exposome. So for the LongITools project, we are working on these challenges and related to the development and the interaction between different cardiometabolic and cardiovascular diseases. Some of the particular interest in the epidemics, you can see them especially in the left-hand side of these slides, where we are very interested in or concerned about the development of pre-obesity and obesity from childhood up until adulthood, and to understand the life course process behind it, and also some of the cardiovascular and cardiometabolic diseases associated to the development of obesity, including heart diseases, type 2 diabetes, and so on. So we all know that those diseases are creating a very important economic and health burden, but what we realize in relation to the exposome and environmental health research is that part of it could be man-made, meaning that there is evidence that air pollution or other type of pollution like noise pollution and also the built environment relates to the development of these diseases. And the questions and why the exposome concept is important is that, first of all, in terms of for the public and policymakers and all of us, it starts bringing attention to the fact that climate, biodiversity, and public health can no longer be considered separately, and the exposome is actually crucial in responding to this multidisciplinary challenge. So even though environmental factors play a decisive role in health, there are currently very few useful tools and actions to measure their effect on health. That's really important technological development to be done. And research in the field usually examines or examined only one pollutant at a time in relation to only one associated health outcome. And what we realized that those health-related outcomes and the environmental exposures, including what is happening in our body, are very tightly related to each other. And we need to have methods and ways to understand this in a systematic ways, and to understand the to have holistic and complex theory approaches. So let me explain a little bit more this, and especially what we try to conceptualize in our health and environment dynamics module of this LongITools project. So what is really important when we try to understand a relationship between an environmental exposure and the disease, what is important in terms of policy making and in terms of being able to make some action is to understand the cause, but we have to understand it at different level as well. So at the individual level, so there is a potential relationship between an exposure and a person having a cardiometabolic disease, living with obesity, or having metabolic diseases. This is also very important, and this can be exacerbated when it goes to the population and epidemic level with the same similar relationship. But it's also really important to think about the fact that to think about it from the ecosystem level as well, where having a chronic metabolic disease or having a population with an epidemic of people living with obesity, of type 2 diabetes or cardiovascular diseases is also potentially causal to the environment we are living in. So these are the things and the relationships that we want to study. And so when we try to understand the causes, we have to understand the causes and the causation at different level. So we have to try to understand what explains those relationships between the exposome and the disease or the health outcome in relation to external factors, so the population-specific factors, some social aspects and other co-factors. We also need to understand what predisposes the relationship. So how do we take into account the heritability, the genetics, and other heritable factors? And finally, and also together, we need to understand how those relationships, how do they produce their biological effects? So this internal exposure. So to do that, luckily, LongITools is not alone. It is a very important initiative by the European Commission to fund and create this European Human Exposome Network, where together we are trying to understand the health impact of environmental exposure across the life course. And this is together with 9 projects equivalent to LongITools, looking at each of them, some aspects related to the exposome, and together it brings a very impressive scientific and innovative network of 126 research groups, and that received 106 million fundings from the European Commission, and it's almost pan-European. Sorry, went too far. So those are the 9 different projects that are funded under the European Exposome Network, and I'll skip, and you will hear more about those projects if you have the opportunity to follow the conference of the EN network on Friday. So what we are going back to, what we are trying to start here and continue together with you is to try to connect science and policy. And this is sort of our, it's an important part for those projects to find a way to bring gaps between science, citizens and policies. So, and what we are trying, what we would like to achieve is to start being able to bring the LongITools results, to be able to understand also our results in relation to the policy context and the needs of policymakers. We also need to So that's why we are starting this sort of a co-creative activities where we will have different events like this one, trying to connect policy and policymakers and science. We will develop having policy forums, and in order to provide different policies and tools. This is also linked to other activities where we are developing at the local level some strategic relationship to start some pilot interventions and interactions. And what we really dream about is to really be able to bring all those to the EU national and local and other levels to be able to make policy and to be able to make change together, and especially to use evidence to develop those policies together. And so what we are probably all trying to develop is, or to dream about, is to be able to build health system resilience and to really put together the environment, health, and the people together in the same ecosystem. And we, in LongITools, we are dedicated and committed to maximize the impact of exposome research. Sorry. And we want to be able to transfer and to make the results understandable to all the stakeholders, including the citizens. And we aim to ensure that the research finding, when they are applicable, may contribute to the development of gender policies and intervention that may prevent the risk of non-communicable diseases that cause such a huge economic and social burdens. So we will continue updating everyone through our innovation platform. So please do not hesitate to visit our website and find ways which gives us a good opportunity to interact. And also we will have multiple events through the course of this project, and the next one, all inviting you, and please spread the word. We will have another webinar on the 29th of September, and we will review clean hair and what the research on clean hair and health tells us. So with no further ado, just thanks all of you for attending this meeting and attending these events. Thank you very much, and I now hand over to you, Jane. So we still go ahead, Jane.
Okay, thank you very much, everyone, for attending this seminar this morning on behalf of LongITools to explore the policy research interface. My name is Rolf Meulen. I'm a professor in environmental health and exposome science at Utrecht University and at the University Medical Center Utrecht, and have been leading the European Human Exposome Network in the first 16 months of its existence, and will be chairing this panel discussion today. We have a really nice setup for this panel discussion. I'm really happy to have 4 panelists online to discuss the policy research interface. First on is Dr. Rupert Suckling, the Director of Public Health in Doncaster Council in the UK. And for people that are less familiar with geography in the UK, Doncaster is in the neighbourhood of Sheffield and Leeds and Bradford, and of course Bradford is a very familiar name for many of the health researchers because of the Born in Bradford cohort and a very lively health community. Dr. Rupert Suckling is trained in general medicine and psychiatry and public health, and really leads the delivery of Doncaster health and well-being strategies. And he underpins basically 3 main values, and that is learn by doing, make the invisible visible, and show relentless kindness. And I will come back to those 3 values and see how that actually relates to this discussion that we actually have on the policy interface. The other member of the panel is Gianna Lobo Vicente. She's an expert in chemicals, environment and human health at the European Environmental Agency. She has trained in chemistry in Lisbon and at King College London, and has been really instrumental within the European Environmental Agency to lead the efforts on human biomonitoring, especially in the UN Biomonitoring for Europe project, which is going to be hopefully continuated into the PARC initiative, which is the Partnership for Chemical Risk Assessment in Europe, where Gianna is also heavily involved. So welcome on the panel as well. The third panelist is Jacqueline Bowman-Bussato. She is an EU policy lead at the European Association for the Study of Obesity. She really has been a pioneer of multi-stakeholder coalition building for social impact. And she strongly believes in empowering all actors to be effective and engaged in optimizing health ecosystems for health outcomes relevant to all actors across sectors through evidence-based policies. And again, Jacqueline, I would like to come back to that personal statement to see how that actually relates to the discussion of today. Our last panelist that we have on the line now is Dr. Savannah Siebert, the LongITools project coordinator, professor of life course epidemiology at the University of Oulu, who just presented the project, who indicates as a personal note that he's a strong fan of large European projects and collaborations, and I think we'll come back to that as well in the discussion about why these large projects and collective European efforts are really important to actually achieve the goals that we have. We were also hoping to have Sirpa Pietikainen online. I will introduce her when we are able to do so to get her into the panel. But at this time, I would like to start the panel discussion by basically going into 3 questions that I laid out for myself to be answered today in this discussion. If you are an attendee in this seminar, please put also your questions into the Q&A so that we actually can feed them into the panel discussion. This is also your panel discussion, so please do so and be active in the Q&A as well. The 3 questions that I have laid out for this morning is, when I think about the policy research interface, I think basically about 3 items, and that is the first one that we have to really explore is, are we addressing the right questions? So is what we actually do the questions that are really important for the policy and for the European citizens? The second one is, if that is the case, are we then addressing those questions in the right way? So are we approaching these questions in a way that would facilitate better the uptake into policy? And that also relates to my third question, and that is, how can we actually foster this uptake into of scientific knowledge into policy? What are the things that we need to do where we all agree that end-of-pipe solutions, as I would call them at the end of the project, are not what we should do, but basically at the beginning of the projects really start to think about how these 2 lines actually go together. And I think that's also why it's so wonderful that we have this LongITools policy seminar at this moment, still in the early phases of the network, so that we actually can do this journey together. So with that introduction, I wanted to move to Rupert and basically go to this first question. Are we addressing the right question? So, Rupert, from your standpoint, being really involved in actually implementing policy, what do you see as the biggest challenges faced by public health and environmental policymakers from your personal standpoint?
Thanks. So, I mean, I think I would say three sort of key challenges. So, the first one I think links to one of my values, which is making the invisible visible. So when I did my training in public health, the exposome wasn't talked about at all, and I think we do need to make the shift from, as Sylvan said, from sort of one exposure, one health effect conditions to multiple exposures leading to multiple health impacts, but also the fact that there are times where that has the biggest impact on sort of the developing body, organs, those sorts of things. So I think thinking about these things in a different way has got to be part of the answer. The second one, I think, is to understand this is not a technical challenge. I mean, when I say that, I mean, there obviously are technical elements of it, but it's the political challenge that is really crucial for policymakers, and being much clearer about the trade-offs that we need to make, looking to address barriers, not continually rewrite strategies, and also then to think about how we might turn some of the things that we want to do into investments rather than costs and drags on our systems. And then I think the third one, and I know there are others on the panel that are probably better positioned to speak about this, does link to my sort of third value, which is showing relentless kindness. And I do think we need broader collaborations, coalitions, not just with industry, commercial partners, but across citizens and public. So, thinking about the role of the city and the bioregion to actually implement some of these challenges. So I think it is about changing our mindset, changing our sort of will, but also changing how we want to collaborate to approach these things together. Well,
thank you so much, Rupert, for that answer. And if you allow me to go one step deeper on the first thing you said about the invisible, making it visible, we already have quite a challenge to talk about one exposure and one health outcome in our communication about public health, of course. And you basically stresses the point, well, we have to go to this multiple contextual idea of exposures and multiple outcomes. And of course, scientifically, I would agree, but I would like to challenge you that how does it actually then work into your local council and towards the citizens, because that's a complex message.
Yeah, so I suppose the example I'd give is around the switch over from the internal combustion engine to electric vehicles in cars. So if you've just taken on a sort of carbon perspective, that definitely is a good switch to make, assuming that the production of electricity in the first place is sustainable. But what, of course, we're also realizing is that electric vehicles still, through the use of rubber for tires, will lead to particulates. So what we see in sort of a policy approach is an approach that may reduce carbon through switching to electric vehicles, may not actually get at some of the other key components in the exposome that actually leads to some of the challenges. And people in the UK will be will know that there was a recent death in London of a young child from asthma, and air pollution was the cause of that, and yet electric vehicles by themselves will not reduce that. So I think that's the challenge that policymakers see, because by human nature we want simple solutions, but unfortunately this isn't a simple area.
I fully agree with that, Rupert. Let me actually switch to Gianna and actually ask you the same questions on what you see are the biggest challenges. And of course, the EEA has brought out a report on the environmental state, basically, of Europe and the biggest challenges. So what would you bring forward, and also where do you think then the exposome thoughts about multiple exposures, multiple outcomes really comes into play?
Hi, thank you, Roel. As you mentioned, the EEA has recently launched the report on environment and health last year, and what I hear, and it's very linked to the work that we do here at the agency, is to think about all of these integrated assessments. So it's not just one kind of exposure, and this is how the exposome can actually contribute to the policy making type of work. We have different kinds of exposure. We have the air pollution, we have the noise pollution, and these two are two of the biggest environmental risks. We have about 90% of the non-communicable diseases are due to environmental factors. So we can also think about chemical exposures, which we find in the environment, and then find their ways into us. The Human Biomonitoring project that you mentioned earlier is also about trying to understand the chemical internal exposure that we have and how then that causes potential health effects. So we have to think of this approach in a more systems thinking, let's say, and it's not easy. It's not easy, like Rupert was saying, but that doesn't mean that it's impossible to be done, and hence why the Commission has invested also in a lot of these projects, and now we really need to make the link from the results, from the research results to the policy uptake. So I think it's important here to think of ways to have a policy board that's part of this project to make sure that these links are fluid between the research community and the policymakers.
Thank you so much, Gianna. And one follow-up question that I have there is that I can see how this happens, what I call within domain problems. So if we think about noise and air pollution, they're basically traffic related, and so your policy would basically be on the upstream factor, and that is basically thinking about mobility options. And if we think about chemicals, I can see it that chemicals that actually have a similar working in the body, that there might be ways to do that. But of course, in the exposome, we're also looking across domains where you actually get differentiation in these health effects of, for instance, air pollution by social factors or by nutritional status. And that raises a really complex issue in scientifically, but I think really also on the policy side, because how do you see that knowledge being implemented where basically the effect of a certain factor becomes conditioned on something else? So I know this is a very difficult question, but I want to hear if the EEA has thought about this.
Yes, so I think you're talking here about social inequalities, right? So the poorer households tend to be the ones that get exposed to most harmful chemicals, or even in terms of climate. So if the world is changing, climate change is happening, we have more droughts, more floods, and normally it's the poorer households that get affected the most. If you don't have good conditions in your home, you're more prone to be exposed to moist, to humidity, so this can cause pulmonary diseases. And we also had a report that the EA produced a couple of years ago on social inequality, so I also would advise you to have a look at that, where we actually explore that part and how the poorer households are more exposed to climate change impacts and vulnerability. On that point, I would also like to mention that one of the main points also of the European Green Deal, not only to make Europe carbon neutral by 2050, but it's also to link all of these policy areas and leave no one behind. One of the policy actions in the Green Deal is actually a just transition. So we're really trying to have a more harmonized way and not let the poorer households and social inequalities get affected the most.
Okay, and I'm really glad to hear that, and of course it's on one hand basically the accumulation of different adverse things that might happen at certain parts of the population, but it might also relate to clinical vulnerability in which the effect of a certain exposure is just simply larger because of the general poor health that actually may be there. Can I shortly go back to you, Rupert, on that topic of where policies become dependent on other policies, because that seems to me a headache, to be frank.
Yeah, there's been a sort of tradition, hasn't there, of using a sort of health in all policy lens to approach things, and people have developed a whole set of sort of playbooks or approaches, and you know, South Australia probably comes to mind as an area that has tried to do that most effectively. But I think that does come back to a sort of technical challenge versus a political challenge. And if you go back to some of the very early policy, you know, particularly in the UK around even tobacco, what you find was that the politicians and the policymakers actually lagged behind public views. So I think that we sort of underestimate where the public are on these elements at our peril, really, and I think that's why, you know, it's good that we've got others on the panel who are much more involved in this space than maybe I am, because I think trying to harness the role of, I'll call it civic society in this is going to be really important for us, and I think they can make those trade-offs. Some interesting work coming out of Japan, people being asked to imagine themselves as decision makers in 2 decades time, and they were much more radical in the decisions that they made than people that were doing that today. So I think, you know, the role of citizen assemblies and those sorts of approaches we should be really exploring.
I cannot agree more, Rupert, and that actually is a nice bridge to Jacqueline Bowman-Busato to actually talk about this role of civic society in setting the research agenda, but also to basically adopt perhaps results that could come from science much more early than policymakers may do. Jacqueline, can I ask you to reflect on that and perhaps also give a very concrete example from your long work where that actually has worked effectively?
Yeah, sure. Thank you so much, Raul. I'm actually going to take a slight step back because I listened with great interest to the discussion before, and I wanted to add something really, really important, and that is which I'll talk a bit more about in answering the direct question, but we're no longer living in what I like to call a transactional policy environment. We're actually living in an outcomes-based environment. There are policies now set in place. COVID has been quite an eye-opener for that as well, to push them through. But there are policies set in place to actually have evidence-based policies towards impact, so towards health outcomes. And what that means is that we can't sit there and only talk about one piece of the puzzle. My colleagues have already said quite rightly that we need to take a systems approach. Thoroughly agree with that with obesity as well. We also very much need to take an outcomes-based approach. And the exposome approach actually lends itself very well to that, because as we know, there are a number of physical and social environmental factors which then lead to, and this is I would say the really core of the issue, which lead to the onset and or the disease progression of obesity as a chronic disease. And the issue that I'm seeing being talked around this table right now is that actually there's no differentiation that's being made. And that has shown, certainly in the case of obesity, and I'm coming on to my concrete example now, and that has shown in the case of obesity why should we say, addressing obesity has been so badly achieved in the past, because essentially big, let's throw some prevention at wherever you are. Let's talk about external environmental factors, but leaving off the second half of the sentence of which impact, but which impact on the biology in terms of onset, so endocrine disruptors, all of these things, or the progression of mobility, food deserts, social issues, all of these things. So what we've done to get onto the how can, I would say, civil society in the case of it, and in the case of EASO, we actually represent from basic researchers all the way through to health professionals, as well as patients across Europe. In fact, WHO Europe, so 36 countries. And what we were able to do through building, I would say, relationships, and also having the evidence there in the first place for decades, but not actually having a real conversation to bridge the gap between the scientific evidence and what can actually be a narrative that's easy for, should we say, the evidence producing arms of international institutions to formulate. So our concrete impact, which we're really, really happy to see, because it's scientifically accurate, it's clarified a lot of confusion in the literature, a lot, has actually been the European Commission recently on the 4th of March categorized or recategorized obesity as an NCD. And what that concretely means is that all of a sudden, all of the research policies, research agenda policies, as well as what I like to call access to care, treatment, all of the what people call policies, but actually it's along a continuum, as well as implementation policies, already have an existing framework for how to approach NCDs, non-communicable diseases. All of a sudden, obesity finally will be able to be seen through that lens. So what that means is, from our perspective, the whole conversation has suddenly changed. We're no longer talking about risk factors, lifestyle, choice, all of these sorts of things, which kind of doesn't make sense in light of COVID when we were talking about immune system compromise, chronic inflammation, why are people dying? That's not about choice, that's about your biology. And in the case of the exposome, it's actually the impact of the environment on that biology. So, and again, when you start looking at the outcomes, you then start to see, well, actually, for research agenda policy making, there are quite a few gaps in order to really address obesity as a chronic disease. And then from an access to care, where are the national plans? Like the other chronic diseases. So in effect, the minute we start looking at a systems approach, that everybody within civil society, be they health professionals, patients, industry, payers, whoever it happens to be, as long as they actually are educated to know about pre-obesity and obesity through the lens of chronic disease, prevention, treatment and long-term management, we actually stand a chance of having meaningful policies made in order to take away those practical barriers for implementation. I could go on all day because it's such an exciting development.
Okay, thank you very much, Jacqueline. And I think what you're saying really is also something that I mean, Joanna was already saying about a policy board, but it's also basically working collectively on the narrative of what does this mean and what actually does it mean towards policy. Can I, Savannah, go to you? Because of course, I mean, you're running one of these 9 very large projects within the EHAN network. So how do you see basically taking that narrative on board that Jacqueline is actually asking for, and taking a policy board on board that Joanna is actually arguing for? So how do you actually do that within your project, Savannah?
Thanks a lot. Well, this is something that we could say this is sort of a core of this type of science meeting, policymaker meeting, citizens activities, where we don't want to reinvent, but we have to, as Rupert was saying, so we have to make the invisible visible, and we have to explain this invisible thing, so that we see as scientists, and we need to explain to everyone. So it's I believe it's very important. So we are in many of the projects, I believe, are starting to follow some of those rules, trying to define our terms in different audience, because we are understanding things in different ways. So we need to do that, and we need to do that probably at the project specific, and also at the EN, and continue, yes, trying to have at least trying to have consistency. So that's very important, and that's a challenge as well, in not only in our project, but in when we have such a big responsibility in the network to communicate with the same sort of narrative. So I believe it's very important, and we started with this exercise.
Okay, and I can see that, Sylvain. But if I may challenge you a little bit,
Yeah.
The answer was still perhaps quite unidirectional, in the sense of that we listen to how we better communicate or use the appropriate language to actually have a more direct connection to policy. But you could also revert it the other way, where you say, well, it's first basically a very large consultation of the civil society and policy to actually kind of give an indication of what are really the research needs, the gaps of knowledge that really will make a shift into the policy. So can I basically challenge you on that a little bit? If how do we make this process more bi-directional, if you want to put it in those terms?
Yeah, definitely. Well, I think we all dream here to have those co-creation activities, and let's say that somebody has to start, and we have to throw the ball, and but we want it. We want to have it back into somebody throw some balls to us and tells us it doesn't make sense, or it's what does it mean? And I believe that the question is about how to educate each other. So that's what I try to explain in our science connection policies / co-creative ateliers. We have different levels, and we are going to go to the in many of those projects to the cities. We are going to Rupert in Doncaster, and Rupert to the citizens to start dialoguing. So I believe this is how we can work together. But I totally understand this, and that's what I believe trying to do, is to try to go out of our box, our ivory towers, and try to understand whether this makes sense.
And I think, I mean, one of the very nice features of the LongITools project is, of course, the co-creation ateliers to really have that policy interface and really get good input. So Rupert, I heard Sylvain saying basically, I mean, you can throw balls to him basically of things that would be basically being a shift for you, right? That if you would have that actually would enable you to change some leverage, some lever. Sorry. So what would that ball be, or what would that process be from your side, Rupert?
Yeah, so we're in the process of looking at our sort of 10-year sort of strategy for the place in Doncaster's, which is bigger than the city of Newcastle, slightly smaller than Iceland, so about 300,000 people. So looking at what our 10-year approach is. And like many places, we've been looking at things like resilient cities movement, donut economics, how do we help everyone to thrive in our place, but within the sort of planetary boundaries. But that's quite it's quite sort of high level concept, isn't it? You know, it's sort of almost motherhood and apple pie, in that we all would nod to it. The challenge is, well, how might you actually get traction on some of those issues, really? And I think there are two ways that I'm interested in how to sort of bring some of the learning from this, you know, this project and the other projects in the exposome. So one is about, well, what are the real sort of generalizable things? So, you know, particularly interested in how the modelers can make sense of this and actually put some of those options out there for us as a place. And then the second is really into the specifics and the stories and the narratives of how this impacts real people in our place today, tomorrow, and the end of the week. And I think, you know, one of our biggest challenges is we've got Ed Miliband as one of our MPs, who was climate secretary in the UK. He always, you know, talks to us and says, you know, well, if people can't make it to the end of the week, they're not going to worry about the end of the world. And I think that is the sort of elephant in the room with this, is that people's time horizons are so short that we need to be able to sort of work with them. You know, many places are also, we are on the front line of climate change. So Doncaster's had very severe flooding, and even those people that, you know, in our most deprived areas, you know, at risk of poverty, are also the ones at risk of flooding, and we, you know, who are likely to be uninsured. So this is definitely a double sort of whammy that people see. And I think what we would be looking to do is to develop a sort of ongoing relationship with researchers. So you may have seen things in the past around sort of digital labs, social innovation labs, and actually, well, what does a sort of what's a place look like that is open to testing some of the findings that are coming out of these research pieces, but it's not purely a sort of, you know, individual mayor or leader of a council making that decision, but it needs to be a collective across our whole population.
Thank you so much, Rupert, and that is actually a very nice bridge to one of the questions that was actually put by the audience in the Q&A on climate change, and is climate change basically covered within the European Human Exposome Network or within LongITools specifically, and I will go to Savannah to reflect on that, but I also wanted to say that Sirpa Pietikäinen, who is the Finnish member of European People's Party, EPP, in the European Parliament since 2008, has had technical difficulties to get online, and was going to give a presentation on what she thinks from her standpoint, what are really important issues. And one of the things that she highlights in her slides is really planetary health, and that is basically where we say that it is human health and the health of the ecosystems or the systems that humans depend on, and that we actually have to look at that holistically. And that was one of her main points that she was actually bringing forward. And that, of course, has a lot of climate change component to that as well, if you think about the loss of biodiversity and so on. So Savannah, turning to you, climate change. So how can exposome research, or how are these projects looking at this topic of climate change?
Yeah, thanks a lot. So I really like the questions in the chat, and so we are trying to answer this question, but as I said before, answering the question, we have to realize that we cannot experiment. So we are trying to understand our observation, so that we cannot randomize people on different type of climates to see some effects. But indeed, we will look at some climatic related aspects and those changes through the life course, and how they relate to changes in health trajectories. What is one possibility, especially in relation to accessibility to biodiversity and how it might relate to our health? There's a lot of research in the LongITools, in the Expanse project, in the Athlete project, and many others on on green spaces. And behind these ideas, it's also to understand the biodiversities and what also can be in terms of the, let's say, the overall exposome in the biodiversity. What is the microbiome and etc. What are those factors that relates to our health, and understand how those are important, not only in terms of, and also sorry for taking a bit of time, we now realize that it's in this holistic approach, that it's complex system theory. So it's not A on B, A causes B. It's A relates to different factors that relates to each other. So what we also realized, I mean, in the situation of COVID, is that the fact that the environment is changing is that we are losing some biological barriers, and that we're potentially protecting us. That's a definition that needs to be studied, but that's how we are trying to study it. So of course we are making hypotheses, and trying to understand the potential factors that relates to this inference. But I'd say in those project exposomes, we are looking at humidity, pollutions, biodiversity, and how they relate to health trajectories.
Thank you, Savannah. I think that that's a good. Those are things that we can do directly, and I think but there also might be some indirect things as well that are in play that we have to think about. And I wanted to basically go to Gianna about that, because I could imagine, and this relates to Rupert's point on, you know, when things are very much in the distance, people don't seem the urgency perhaps, or basically think, okay, I can just push it off for another day and worry about what I have to deal with this week and not what might be coming down the line in a few years from now, which is more than human to think that way. But of course, there are policies that can be connected, and perhaps that's also the thing that we have to think about by environment and health, but also climate and health, but also energy transition. I mean, we have a few of those very large things that have a lot of political energy, and sometimes actually drive the process quicker than perhaps the health implications. So how do we make sure that we connect those different drivers of societal change, really, so that we can make the health basically not piggyback, that would be the wrong term, but basically in coexistence move with the other drivers that we actually can leverage?
Move together instead of the piggyback, right? Like you were saying, exactly. I think to answer your question, before I elaborate a bit, but to answer very quickly, I think the important thing is to involve different actors in the same game, let's say. So if you were thinking of environment and health, but also in the terms of the influences of climate change, then involving a climate change expert, an energy and transport expert, etc. Because environment and health is not just air pollution or noise. There's a whole different range. For example, if we think of pesticides involved in the farm to fork strategy, that's directly linked to the biodiversity action plan. So you have all of these different links. For example, chemicals. We're trying to remove harmful chemicals from recycling, so to improve the circular economy. So that's another action plan. So you have all of these different links to these different policies. If we think of climate change, for example, climate change is also influencing the increase of mycotoxins in crops, which is a fungus that affects health. So you have all of these different links. And just to pick up also on what Rupert was saying earlier, it's very important that there's a bidirectional fluidity here. So the researchers telling the policymakers what they found, and the policymakers in their turn asking the researchers, well, we need answers to these questions. Can you help? How long is this going to take? And have a constant dialogue to allow for the regulations to be set before it's too late. Because as you were saying, sometimes we think that things are too long ahead of the line, and in fact we need to be a bit precautionary and preventive here as well. But for example, with the EU Green Deal, they're also thinking of 2030, and 2030 is just in 9 years, so it's not that far ahead if you think of it in terms of environment and health and policy making and how these administrative things take time. So I think that things are now getting ready to be in the game, and it's really good. It's a really good window of opportunity that all these projects can contribute to this.
Thank you so much, Joanne. And I know that Jacqueline wanted to basically chime in on this. So Jacqueline, go ahead.
I do. I mean, you know, I absolutely love what you're saying there, Gianna, but 26 years in this environment has taught me. So we all remember the Millennium, what was it called? Yes, the Millennium Development Goals, and how they just didn't manage to do very much. And one of the main reasons I tend to think, apart from donor countries actually imposing their own value system on recipient countries, lots of literature there, but actually when you say 2030 is 9 years away, that's approximately 2 to 3 institutional mandates away. So from a policy making perspective, it's all changed at least twice in that time, which means if I look back at the amount of mandates I've lived through, put it that way, international level, there's always what I like to call a cleaning of house at the beginning. So at the beginning of this mandate, which I thought was actually a really good thing, we moved towards mission driven. So very much, you know, what's the real question that we want to address? And quite rightly, how do we make sure that every single policy portfolio is actually driving to address that particular question? So that to me was really good. Who knows what's going to happen in 2-3 mandates, you know? So I think that 9 years isn't that far, but it is from a policymaker perspective. And then the other thing I was going to mention there as well is that, again, from an EASO perspective, we've actually just completed through dialogue actually with the European research arm of the Commission, we completed in the end multi-stakeholder research agenda gap analysis with 37 different organisations, including WHO and OECD as part of the respondents. And what we were able, and you know, various other pathologies related to obesity. So it was actually some really interesting results published later on this month. But essentially what we could see is that sometimes people don't know what they don't know. So what we were seeing a lot in the various calls and research priorities for obesity, apart from, you know, the obvious that I've gone into already, but what we were seeing was that because there wasn't this bridge of ongoing dialogue, not just what do you want, or this is what we think, what do you think, because everybody's so polite that actually you end up in such a polite discussion that you never have the hard discussion of, well, these questions are not that relevant because they're not really answering, in our case, onset of obesity, understanding the different biologies of obesity, onset and disease progression, including exposome. So all of these sorts of things mean that, to me, it's not just a, if you like, of the 4 levels of consultation, the lowest level, it's actually an ongoing, trusting relationship, and not just between researchers and policymakers, because quite frankly, that never goes well. It actually needs to be everybody, 26 years, you know, so it actually needs to be all of the different actors who will be impacted by such policies and who need to see a decent outcome. They may or may not feel that they're positively involved at the moment, but to actually have that discussion before we get to the real politicking of the piece, because that way the policymakers, and we've seen this with the MEP interest group on obesity and health systems resilience, for which we also coordinate, as well as at EU level, as well as the open, so obesity policy engagement network, another example. So that, as I like to say, everybody is actually lined up before we get to the starting line, so that we're actually moving forwards together, and that's actually what's really, really needed.
Right. And can I pick up on that, Jacqueline? Getting to that starting line, and that was actually one of the questions in the Q&A, and this was coming from Mitchell. I don't have last names in the screen that I have, so sorry, Mitchell, if I'm not having your last name. But I want to put this to Rupert, because basically the question was, well, how do we build the capabilities of individuals and communities so that they can get actually prepared to the starting line, as Jacqueline puts it. So how do we do that, Rupert?
I think if I knew the answer to that, I would retire and be a very rich man. I suppose what we have seen, though, we have seen huge involvement of local people in environmental activity. So whether it's through things like Great British Spring Clean that we have in this country, where people go out into their areas, people increasingly interested in taking over assets for their community, and also then more recently, I suppose, even things like carbon literacy and understanding that approach. I think the thing I've sort of learnt over the years as a policymaker is never underestimate the public. As William Gibson said, the future's already here, it's just not evenly distributed. So my job as a policymaker is often to find the energy, the idea, the future that's already happening in my place, and then to stop my organisation snuffing it out or trying to colonise it in some way. And I think that is I suppose that is one of our challenges, is we do see some of this activity, but if we could bridge the gap between the exposome science and the scientific community and the policy community with our publics, we might be in a very different space. Just think about what Greta Thunberg's achieved in terms of bringing that together, and I think that's what we need. We need Greta Thunberg's in all of our communities across Europe to make a difference in this.
May I just add something about Greta Thunberg, Rupert? That's a really interesting point, which brings us back to public concern and how are we going to get the citizens involved. Greta Thunberg managed to get everyone looking at the environment in a different way. Of course, us, me working at the Environment Agency, this has been part of my work for quite some time, but it's true that the societal concern was not at all at the level that it is now. So how do we keep this ball rolling? How do we keep engaging the citizens? And how do we show them, how do we keep them informed of preventive measures? So, for example, in the Human Biomonitoring Initiative, we have focus groups to understand how the citizens think about chemical exposure, for example. So it could be interesting to get them also involved in different initiatives or do some citizen science initiatives as well, for example, to engage the community.
And I think that is that's very good, Joanna. And I hope that this policy webinar that we have now perhaps results into something very concrete, and that is actually to when we can travel a little bit more to actually make it out to Doncaster and see basically when we actually are with the foots on the ground. I mean, can we actually see how we actually get the right questions? Do people understand it? Is this really important? And I think this might be a good way to do it. I want to go to one question of the audience, because questions have been coming in, and I want to address those questions as well. And one of the things is basically the question that was there from Mariana on basically the integration step. Like, you have a lot of evidence about multiple exposures, multiple risk factors, both in positive and negative sense. So who should do that integration? Is that the research community, or is that the policy community that needs to think about that integration? Anyone that wants to basically jump into that question? I see Jacqueline's hand raised. So Jacqueline, very shortly, 1 minute to give your opinion, and then see if others want to chime in on that.
Yep. Okay, it's everybody. And what I would say is, from experience, policy is not an add-on for the evidence. We need to be there. My job is to be the bridge between the evidence and actually making sure, lawyer by education, making sure that we have meaningful policies and related legislation. By just including policy people when there's a result, actually, it's a 50-50 gamble as to whether or not it's going to be something useful. Yeah. So involve us at the beginning to help thrash out, indeed, the research question, because we need to know that it's something that's actually useful.
Thank you so much. Is there anything to add by Rupert or Joanna on this point?
So, I mean, I would just agree with what Jacqueline said. You know, so this isn't a linear process. This is I see it as a spiral. If it works well, it's a spiral that goes out, that creates momentum. If it goes badly, it's a spiral that loops inwardly on itself, and we end up with those echo chamber conversations and nothing happens. So definitely agree with what Jacqueline said.
Thank you so much for that. We actually are in already the last 5 minutes or dying minutes of this webinar. And I think we had a great discussion and touched on some important topics, and unfortunately we are not able to address them all in full length. So that's actually my last question, because we're gonna repeat this at some point in time within LongITools or the network. So from your standpoint, basically, what is the topic that we actually should address more, and what would be the talking point for next time based on what you have heard today? Savannah, can I start with you?
Thanks. Well, let me put it. I think I don't know what would be the priority, because we are talking about the exposome, and there are so many. Well, I think we have to take. So let me take a step back. We need to analyze what we discussed today, and be able to continue and make sure that we don't go into this echo chamber that Rupert was just talking about. So that's it. That's what so I don't want to say, well, we have to do that. We have to do that. We have to. This is a dialogue. So we couldn't. I cannot dictate what we should do, but maybe others have ideas.
Rupert, can I move to you for a short reflection on that?
Yeah, so I think what I would be interested in hearing more of or understanding more is from sort of places that are wrestling with these challenges. How are they doing that? You know, mass conversation, civic engagement. How are they progressing? It'd be interesting to get a sense of how, across the different areas that we've talked about, so obesity, some of the environmental challenges, how similar or different they are. But you know, I think the future is there. There are people that we, if we don't know about them, we should find them, and we should listen to their stories.
Thank you so much, Rupert. Joanna, can I ask you the same?
Yes, I think I know that Jacqueline was a bit skeptical about this dialogue between researchers and policymakers, as she's been doing this for quite some time, but I'm not giving up on that, because if we need to get legislations in place, be it at EU level or national level, we need to get this dialogue going. And I understand that with Corona, it's difficult to have through these virtual events to build relationships and build trust between partners. But I would really like to see that going a bit more. And Roel was already suggesting to Rupert organizing something, so presentially. So perhaps that could be a good opportunity and get some more policy makers involved in this process. And obviously the citizens as well, understanding what the citizens would like to know and see also from there what's the public concern. Thank you.
Yeah.
Thank you so much, Joanna. Jacqueline, to you.
Oh my goodness. I'm going to agree with every last thing that you said, Joanna. My line is that it's not only researchers and policymakers because that's what doesn't go well. It's everybody that needs to be in the loop from the beginning. And in terms of things which we could be doing more of, I would say get back to basics. We need to embed what is the exposome narrative, because actually we give one high level line and then move on. But what does that exposome narrative mean to the different stakeholders? Are we actually aligned on what it means? Are we aligned on what's a shared value? What's in it for the different stakeholders to actually make this work? So that's what I would like to know more about. And it's certainly the trajectory that we took in bringing obesity out of risk factor lifestyle choice into, which is just scientifically inaccurate, into a bona fide non-communicable disease in its own right. So I would love to see that in the exposome environment, so that when these projects are done, actually we have built-in champions who are competent and confident to move through. That's what I'm looking for. Yeah.
Thank you so much, Jacqueline, as well, for that reflection. Unfortunately, I think that brings us really to the end of the panel discussion, and I just wrote down 3 points that really, I think, resonated today, and that is policy is not an add-on. A simple one-liner, but it is really true. We really have to think about how do we get policy in the beginning, and really basically have this coexistence between the research and policy. That also brings me to the fact that there is really importance to work on the exposome narrative. The exposome narrative has been well received within the scientific community, and is trickling through to the policymakers because they see that something is happening in the science community. And but I know from experience that, for instance, the Dutch Health Council is indeed struggling with that. What would that mean? What would the results be from these kind of projects, and what would that mean really for policy and advice? And they're working on a report now, and I think when we do a follow-up, it would be very nice to actually reflect on that report, because I think it's one of the earliest reports to try to answer that question of what does it then mean, and what can we use. So that the exposome narrative is hugely important as well when we actually go to communities. And that's the last point that I wanted to raise, which Rupert really brought up very elegantly, and that is the learning communities. That is that we need to learn from each other. We need to see basically how is that knowledge about environment implemented in different cities, in different neighborhoods, and what are basically the success factors that actually lead to, in certain neighborhoods, that things change, and for others where it doesn't happen. And unfortunately, what we often see in implementation research is that it happens in one city. It happens for a period of time, for instance, within a 4-year project. But rarely that lessons learned gets really taken up and be used in another city, in another project, so that we actually get sustainability, and we actually get these learning lessons transferred from one to the other. And I think that is one of the other aspects that we really have to think about. How do we do that? How do we take these early lessons of exposome research, and how do we help the different communities to actually use that knowledge when it's there? I think that those were the main points for me as a take-home message. I'm going to study that tonight and think about that. I hope that the audience will do that as well with their own reflections, and please put them back to the LongITools teams as well when you have reflections, or where you think, okay, well, these are really important points that I think we need to take on. So with that, I want to hand over to Joanne, and of course thank all the panelists for a wonderful discussion.
Okay, thank you, Raoul. Yes, before we close this morning's webinar, I would like to say thank you to everybody as well. Thank you for all of our guests and to our speakers, and for those of you behind the scenes. And again, apologies for the technical issues we've had with our keynote speaker, but hopefully there'll be another opportunity to hear from her again. I think there has been an awful lot of really good information shared, and some relevant and pertinent questions raised, and we can definitely feed a lot of this into the LongITools project activities and those of the other projects in the network. I think you've all summarised your key points nicely, and I shall look forward to going through all the
recording of this event and making sure that we capture all those properly. The LongITools consortium is really committed to maximising the impact of our research, as Sylvain said earlier. And we need to make sure that the results are relevant, understandable and accessible to all of our stakeholders. We're very clear about that. We want to make sure that if it's possible that our research results don't just sit on the bench, the lab bench, they're actually used to help contribute to the development of joined up policies and interventions to help reduce the risk of developing non-communicable diseases. So I think if anything today's pointed out to me is it's really, really key that we keep talking to one another. There's been some really useful exchange, and we would very much like for all of you, both the speakers, panelists and the guests today, to keep in touch with us and with the network going forward. And there's a number of ways that you can actually do this. So firstly, there is the European Human Exposome Network, the EHEN conference, to be held on this Friday, so that's the 11th of June, and it starts at 10 Central European time. So this event is also another EU Green Partner event. You should be able to see on the slide showing now, and I think it was put into the Q&A feed earlier, a link so that you can register to attend this event. The aim of the conference is to enable policymakers, researchers and citizens to learn more about the exposome concept and how the network advances research and contributes to better health care and policy making. There's a number of things that are going to take place throughout the day. There's keynote presentations, thematic breakout sessions, and there'll be 2 panel discussions as well, like we've had today. In addition, there's also our next LongITools Policy Forum event, which Sylvain also mentioned. The focus of this event is going to be on clean air, and that's due to take place on the 29th of September. There's times to be confirmed, but it's likely to be around 4 o'clock UK time, so towards the end of the day, so it doesn't interfere as much with the working day. The aim of our Policy Forum events is actually to make enable policymakers to access the research and the science from the LongITools projects and to help exchange that knowledge and learn from one another. We will obviously send you all an invitation or details nearer the time if you were interested in that. And of course, if you want to keep in touch with LongITools, there's a Twitter, so please follow us if you're not already doing so, or follow up on our website, which has the innovation platform, which Sylvain mentioned earlier as well. And you can also visit the EHEN website for updates on all the other projects and the activities we're doing there. So finally, I'll let you all go and have a cup of tea or coffee. Could I please ask you to please complete the event survey? So that will be put through, again, the question and answer feed. And once again, many thanks for everybody's time and input, and I do hope you all have a very good rest of the day. Thank you very much.